we need to make sure that we do regular checkups. My fellows, if you do regular checkups, they will help you to identify early warning signs of some diseases or illnesses. So please, even if you feel sick or you have a sign that you're not understanding, please rush to a healthcare provider. So some of the regular checkups you can do, you can go to the hospital and they do physical examination. This one, just the healthcare provider will use his or her eyes to see what you're suffering from, and then we'll use some other things to do what? To feel. We'll use the fingers to palpate. We'll use a stethoscope to auscultate. If maybe you have problems with the lungs, we'll use some of the tools. So under physical examination, there are very many things that lie there. So they can also do a height and weight. This one will help us to know your body mass index, a tool that will help us to realize if you're either healthy or unhealthy, through knowing whether you're obese, overweight, you're underweight, or you're malnourished. So height and weight are really vital. Some people, your heights are not corresponding to your weight. So please, if you go to the hospital and maybe they find out this, there are some measures that can be done so that you can be healthy. So they can also take a blood pressure to know your normal values, to identify if you are a hypertensive patient or not, or if you're at a risk. So they can also do some blood sample checkups. For example, they can check cholesterol levels in your blood. They can do liver functioning tests. They can do very many tests just to rule out anything that may seem unhealthy. They can also do a blood sugar test. This is a test that we do to rule out if someone is diabetic or not. So it's really a good test. So you can also do dental checkups to rule out any mouth infections or diseases like tooth decay and diseases like gingivitis. So please, you need to do all that. So you can also do some cancer screening checkups to rule out if you're still healthy. So we have a lot of screening things that can be done. We have a lot of medical checkups that can be done just to ensure that you're really healthy. We can do scans, for example, a CT scan that is to rule out any abnormality in certain organs, for example, the brain and some other organs. We can also do chest x-rays. Very many things can be done. Urinalysis to rule out if you don't have any urinary tract infections. Remember, we talked about the kidneys, how kidneys filter blood. So we need to do all these things to make sure that your urinary tract is not infected. So please, that's all. You have to make sure you do regular checkups as far as health is concerned, that we won't regret. So please, thank you for listening. My regards to you all, and mwebale kumpuliriza. Abatana subscribinga badde nsaba musubscribinge, mulikinge, share to your fellows so that bwe mba ntaddeyo video endala musobola ofuna notifications. Thank you so much. Have a blessed day. Basemera TV, your health is our pride.